In this lecture cast, we'll be discussing the highest levels of evidence that are used to answer focused clinical questions. In the last lecture cast, we discussed the different levels of evidence that are used to make clinical practice decisions, ranging from expert opinion up to systematic reviews of research clinical trials. So there are varying levels of evidence, and we really rely heavily in dentistry on the results of randomized controlled clinical trials. Some of the best evidence we can get is by looking at the results of these types of trials. In a randomized controlled trial, the subjects are randomly assigned to two groups: the experimental group, which receives the intervention that's being tested, and the comparison group or the control group, which receives an alternative treatment. Then these two groups are followed to see if any differences between them exist. Once the trials are finished and the evidence or the results are collected, usually this results in a publication in a peer-reviewed journal. So the highest level of evidence comes from systematic reviews of the literature. Systematic reviews identify and evaluate all the best evidence that addresses a research question. Systematic reviews of high-quality, published, randomized control trials are crucial to evidence-based practice. The expert doing the review will examine publications of randomized controlled clinical trials, but will also look at other publications, reports, case studies, and all the information that addresses the clinical question. These reviews are done by experts and are published places like the Cochrane Library or the American Dental Association Evidence-Based Dentistry website. And there's a link to that website in your learning resources for this course. There's another type of evidence that is not as highly ranked as systematic reviews. This is called a critically appraised topic, fondly known as a CAT. This is a structured 1 or 2 page summary and evaluation of the best available evidence on a focused question. These CAT topics are best kept in easily accessible places so that they can be used by practitioners to help with clinical decision making. There's a link to the University of Texas Health Center at San Antonio website that contains the student critically appraised topic database that you should investigate, and there is a link in your learning resources to that site. So CAT is a very precise, brief, structured summary of the best evidence. It asks a focus question, a very efficient and effective search of the literature is done, looking for the highest available research evidence. Then it's critically appraised, that evidence is critically appraised, and then it's carefully considered, and the information is then placed into a structured 1 to 2 page summary that addresses the evidence that answers the focused clinical question. So how are systematic reviews of research different from critically appraised topics? Well, the next 2 slides summarize the differences. However, systematic reviews are very in-depth assessments compared to concise summaries of best evidence that are done fairly quickly in a CAT. So a systematic review can have wider scope Then a CAT, which is narrowed down to a specific clinical question. Usually systematic reviews are performed by content and methodology experts, whereas very often clinicians, students, practitioners will put together critically appraised topics. So in a systematic review, the literature search is exhaustive, as opposed to a CAT, which is done using the most current evidence and is done very efficiently with time-saving strategies. So with a systematic review of the literature, there's a lot of effort because those experts don't leave a stone unturned. Whereas with a critically appraised topic, you work very quickly looking for the best available recent evidence. The commonalities between the two are that there's the clinical appraisal of the quality of retrieved evidence is assessed. With a systematic review, it can be quantitative, and very often meta-analyses using complex statistics is performed, whereas a CAT is usually a brief narrative summary. Systematic reviews are found in journals, books, scholarly publications, as I mentioned before, on websites like the Cochrane Collaboration library website, whereas CATs may be in an institutional collection or in a database available on the internet. In terms of potential for bias, it depends. Systematic reviews are usually so comprehensive they weigh all the evidence, but CATs have a tendency potentially to have bias injected into them. Here's a link to the CATS database that's available at the University of Texas Health Center at San Antonio. This is also in your learning resources for this module. And you can see examples of critically appraised topics that were done by dental students at the University of Texas. So, when treating patients, using the best evidence out there combined with the dentist's skills and what the patient needs and wants is how dentistry is best practice. For the discussion board for this module, please post a PICO question, a very focused, well thought out question, along with what part of the evidence-based decision-making process was new to you.